Hey, Jennifer.
Hi, can you hear me?
Yes, yes.
Okay, great. Wasn't sure if you'd be able to. All right, so I have a question about my son. His name is Aiden.
Hmm.
He he's for ever since he was about 13 years old, he's been struggling with growth issues. He started growth hormone back then, and
At age 13.
yeah, at 13, just because
And how old does he know?
he's 19 now.
19. So for 6 years. Okay.
Yeah. So he's at the highest dose of growth hormone and he's
And
growing.
when you say growth hormone, you're talking about human growth hormone? HGH?
Yes,
Okay,
yes.
gotcha.
Um, and he's made some strides. He's gotten to about 5'4". He should be at about um he should be around between 5'7" and 5'9". The concern is he's already 19. His growth plates have not closed, obviously, but he's probably at about a bone age of about 15, between 15 and a half. So uh, a couple things are going on. Um, we're starting to notice that he's losing um, the ability for muscle. He's going down, like um, he's not as strong as he used to be. Um, he's they say his testosterone levels are extremely low. They're at about a 40 when they should be somewhere above 300. I don't have all of the notes right in front
Wow.
of me.
For a kid his age, that's
Yeah.
like
So
those are old man numbers.
yes. So
Okay.
he's
Any
doing the
any
best he
other
can.
any other endocrine issue, like any issue with blood sugar or adrenal function, anything like that?
Well,
Thyroid issue?
yeah, well, he's on thyroid medication too
Yeah.
because of the
Okay.
growth hormone.
Yeah.
Now, when
Okay.
he was younger, he had a brain scan, and they say it's a small little um, abnormality on his pituitary, but they say it's usually something that's normal, and it hasn't really been looked at as anything. I'm I just feel like there's something else that can be done. He can
Yeah.
we can take testosterone, but the issue with testosterone and the issue with Aiden is he's extremely healthy. He doesn't want to do any, he's already on the growth hormone. He's already worried about going off of it because he wants to be able to go off to college in the fall of next year.
Hmm.
And we're trying to get him to a place where he doesn't have to be dependent on the growth hormone. His testosterone is back. And besides taking the testosterone can cause the growth plates to close.
Hmm.
But he's having trouble with um, fatigue
Hmm.
and uh, just lower, almost like just feeling malaise, feeling like not always as happy as he could be. Just come see, come saw, you could say
Hmm.
all the time. And um, there's some bright moments there, but for the most part, it's okay. When is this going to happen? Now, Aiden's on board with pretty much doing anything because of his mindset, and he with more natural because of his concerns, like of having uh, the medications and what they could do in the future. So one of the things that he's up for trying anything that's gonna work. It's
Okay.
just that we're concerned about he needs growth, like he needs to grow. And I'm
Yeah,
concerned
and
that
it,
something's going on with his pituitary that we're missing.
yeah. So, well, I would say pituitary, but there's probably also like a hypothalamus issue that, well, I mean,
Right.
so, hmm. And
Their
was
diet.
there ever like any trauma? Was there like a car accident or he
Oh,
fell? Or,
there's been a lot of trauma, like absolutely. His older brother was there's his older brother has spina bifida. Over the years, we've had multiple things happen in our family, just
oh,
um, that has caused angst in him. Like he's had a we've had a house fire, and then he was recovering from that, and that's when all of these other issues started. Now, he's always been more anxious, and I've always had to work with him with techniques to help um, calm him down. He's uh, does meditation, and we've been recently doing sounding Om, ONG,
mhm.
um, to help with everything that's going on. And he responds really well to that, and so he's yeah. So the trauma, yes, and
Okay.
um, but he's willing to learn and to do whatever he needs to do.
So with this, like sometimes you see issues with like I just like it kind of falls under like what we would call like failure to thrive. When there's like growth issues or it can be like almost like all the body systems aren't kicking in, and sometimes it's that way just from birth. It doesn't really show up, but like the traumas can complicate it. They probably didn't cause it, but it's just like a bunch of stresses. And he sounds like he's a little bit of an introverted kid.
Yes,
Yeah.
he's
So
very much.
yeah, so introverted people can also become like more sensitive and can be more prone to like things like fatigue. And again, it's not causing anything, but it's like we want to like factor that in just because of like potential like depression and melancholy and things like that. And so I would like to start kind of almost in a way like really simple, but in the simple approach, kind of aggressive with the simple things. And there'd be two things that I'd like for him to use, but we'd use them kind of aggressively. And here's my thought with that is that for one, we want to jumpstart and really stimulate endocrine function across the board. We don't really want to focus on, getting more testosterone or more, whatever. We want to jumpstart the whole endocrine system, because, sometimes that's just what happens is the system never really kind of got going the way that it needed to or should have, and is as much as you try, you're just always kind of dealing with something that's running like at half speed. And so whenever you're treating something in the endocrine system, every once in a while you can treat something specifically and go, and then it works and you don't really have to worry about the whole thing. But most times you have to kind of treat the whole system and then come back to the gland that's not functioning. And here it sounds like it's like kind of all of them. And so um, I would like to have him do a couple of things. Like there's two for sure, and there's one I'm kind of a little bit on the fence now, even as I'm talking. And so I'll just talk this out. So first off, I would like to put him on a combination of frankincense and myrrh. And the reason for the frankincense and myrrh is when they do it individually, but when combined, they're very fortifying and strengthening and kind of stimulating to the whole endocrine system as a whole. And especially the hypothalamus. um, they will impact the pituitary, but not super specific to the pituitary. We can do some other things specifically for the pituitary. And, sometimes people have like a little growth on there that's benign, but it still can throw off function a little bit. And
Mm-hmm.
they're actually quite common. They're, can't remember what the number is, but there's a lot of people walking around with these little growths on the pituitary. But you usually go through your whole life and it's not an issue. And so I mean, it could be that, and it could be that just his endocrine system just never really got started, or maybe started and slowed down as he was growing. And
Mm-hmm.
so I would like him to take probably 3 to 4 drops of that blend. So when we mix frankincense and myrrh, we call it 3 wise men. Or you can just take frankincense and myrrh and mix them together, kind of like even amounts, right?
Mm-hmm.
And so I would have him take 3 or 4 drops. It could be either just directly on the tongue or in some water or juice, like 2 times a day, and then eventually even work up to like maybe 3 times a day. We might even increase that dosage at some point, but for right now, twice a day I think is pretty solid. And then the other thing is, I would like him to at least inhale cinnamon, like cinnamon or
Mm-hmm.
cassia, but I would just go straight up cinnamon leaf, like not necessarily the bark, not necessarily cassia, but I would just go straight cinnamon leaf. And so here's my rationale with that. So for one, it's going to fight off some of the fatigue. It might not completely remedy it, but it should increase his energy levels. Two, it makes him a little bit less introverted and a little bit more like turning like outward, right? So it is something that we'd use to treat things like melancholy and depressive states, especially when the person's very introverted. But usually when people are introverted, there is a greater potential for some depression, because they usually are always like sitting and kind of processing and looking inward. And so when things are being difficult in the environment, they kind of always like look inward with it. And if you notice somebody who's like an extrovert, they're never depressed. It's because they're always focused outward, right?
Mm-hmm.
And so for really super sensitive kids and adults and things, I like to go cinnamon. And the third thing with that is that it acts as a body stimulant, like across the board, and not a stimulant like caffeine, but it just helps to jumpstart the body systems. And it doesn't even have to be directed anywhere. Just long, slow, deep breaths on a regular basis. I'd say 20-25 inhalations at a time. And I mean, he can carry around his pocket, and whenever he wants to do it during the day, he could do it. But I'd say at least 3 or 4 times a day, and probably in the morning, a couple drops in water and drink it.
Okay.
And the idea is to just keep jump starting his body systems. We use cinnamon whenever there's like a failure to thrive, except like in small children. Like we have to use like different things there, but like after the age of like 7 or 8, we jump into the cinnamon and then just modify the dosage. Given his age, it would be more about his tolerance of the cinnamon more than anything. And the thing with him inhaling it is that sometimes the anxiety is actually because the body systems are so sluggish. It actually will produce anxiety. Sometimes it's because the breath isn't deep, and sometimes it's because of whatever. But when systems in the body are not like functioning like they should, it actually starts to cause anxiety. And we just had a case about 2 months ago where this person she had just had really bad anxiety. And it was like the things that you would normally use to treat anxiety were not touching it, not phasing it. I mean, I even did a healing on her, nothing was phasing it. And I was watching her breathe, and I was watching her movement and everything, and I just gave her some cinnamon and kind of the same instructions. Just inhale it as much as you want. And even I think she just walked around, and she was inhaling it all day. Like, she was just inhaling it like it was oxygen. And it took about 2 weeks, and she called me back, and she said the anxiety's gone away. She hasn't felt this calm in probably like a decade. And it's just because it's stimulating the body's systems. But like, when the body's like not functioning like it should, part of the issue is the respiration is also weak. Like, like, it's not like a good strong respiration. And so, like, cinnamon is also a stimulant to respiration. Like, it doesn't make your breath go faster or anything like that. It just makes it stronger. And in that, when the breath isn't strong, it really can throw off the way the nervous system functions, like all aspects of the nervous system. And again, I don't think it's causing his issues, but it's definitely not helping. And that you're starting to see like decrease and muscle tone and muscle mass and strength and things like that. That always strikes me a little bit as being a little bit neurological. And so I'm going to guess that either his breath isn't as deep as it could, or it's not as strong as it could. It's not, taking in as much air and oxygen, but the byproduct of that is it's not moving the blood and the lymph in the body like it could. And then it's not aiding the nervous system like it could. And so I'd really just go two things right now. I mean, there's a couple other things that I'm thinking, but I'd almost like to see how intense treatment with those two is treating him and how he's starting to feel before we start shotgunning a bunch of things. As far as the pituitary itself, I like the idea of doing this for a while, because then when we come in and treat the pituitary, I think it will respond better. But Sylvester pine can work. Neoli can work, which is in the tea tree family. I kind of like Neoli for him, just because it's like it gives the body like the fire in the body, to like function. Like, Neoli is really good for that. Like, when a person's like really worn down or depleted, especially after like being sick or something, you use Neoli to kind of put the fire in their belly a little bit. And one of the things that it's good for is strengthening and stimulating pituitary function. Same with Sylvester pine, and same with black spruce. And there's a couple other things too, but I'd say at first, let's just do cinnamon and do the three wise men. Treat them like that pretty intensely for like a week or two. And then after that, let's go through and reevaluate him. And some of what we're wanting to see is like, is he having energy level? Is he having strength? Is he feeling better? But also, how is the anxiety, and how is he just feeling overall, like kind of emotionally, mentally, all those would be indicators. And, a lot of times depression can obviously be psychological, but a lot of times depression is the body is fatigued or sluggish. And so, if the body doesn't get stronger, then you're always kind of trapped in that depressive state because the body is so fatigued. I mean, it's like in the workplace, we would call it, the like burnout, or like somebody who's a workaholic then will like crash and things like that. And so it's just body fatigue. And
Mhm.
so let's strengthen his body a bit. We might augment it with some herbs and things, but I'm really happy with these two things as the first treatment, first wave
Okay.
of treatment with that. And then we can always adjust. But I almost want to see how he reacts to these two things. Because good or bad with how he reacts, that still tells us some information and guides us into the next step rather than just doing a whole bunch of things at once.
Okay. Can I just add something to
Oh, of
that?
course.
Ask,
Yeah, yeah, yeah.
so just to clarify with what you're saying, this is the first part of it, and then I have a second part. The first part is, you know, we can't even get a hold of growth hormone right now, which is the interesting thing, is
Really?
because there's a shortage. And so we've been working on it. So
Wow.
this is incredible that this is happening right now. So I Aiden and I don't really want, he doesn't really want to do testosterone. Um,
At
and
his age, I mean, I would really hesitate for a little bit. I mean, I know that's part of his fatigue and everything, but
right,
if he starts taking testosterone now, there's a good chance as he gets older that he's just always going to have to take it. And there's the growth plate issue, but it could further complicate like hormonal levels as he gets older, especially like in his 40s and 50s. But the other thing with taking large amounts of testosterone over a long period of time is it makes him very prone to blood clots.
okay,
Like taking it from time to time, not so much, but if he was having to do it like all the time, like for 5 years, 10 years, whatever. Usually with testosterone therapy, you kind of try to jumpstart it back to like a reasonable place and then back off of it. And then just, try to supplement naturally and everything. But especially with the pharmaceutical testosterone, there's starts to be the potential over a long period of time of like clotting issues. And so
okay.
it wouldn't be so much an issue now. It would be again, like as he gets older, we don't want to like predispose him to clotting issues when he hits his 40s and 50s.
And that's what he was worried about. So
Yeah,
we're definitely going to do all this. It's just right now we don't know. I don't even know if when we're going to be able to get a hold of more growth hormone, but we're working
you're
on
right.
it.
Yeah.
So the other the other part of this is he has a very slight curvature of the spine, and it's right about like at his heart level.
Okay.
That it's been improving. Like he gets chiropractic work, he gets massage, and we actually use the margarine with the massage, and he sees a
Okay.
physical therapist to help him with realignment and balancing out the muscles. And things are working, and energetically we've been doing a lot of work, and things are coming into alignment. I just didn't know if there was a sense there, if there would be something else that could help him with this as he grows and as things get re-stimulated again.
So is it just that a shoulder or hip is elevated, or is he like have idiopathic scoliosis?
And
Like
so I don't it the skull I don't know how to really answer that. The scoliosis
so
is
if you
right
if you
around
look at him with his shirt off, are his is each side of his rib cage the same shape, or is one misshapen?
what the so there it's not even. Like his rib cage, you can tell one side is misshapen versus the other. So
Okay,
yeah.
so that's probably idiopathic. Um, yeah, that's a tough one. Um, so you're getting chiropractic and you're getting some massage done. Is it just massage, or is it somebody who specializes in neuromuscular therapy? Or
She's doing massage, and she's doing cupping, and she's using the marjoram with it. And
okay,
um he's also getting physical therapy too.
okay. So that should be helpful. I mean, the idea, like with and it sounds like your massage therapist is on it, but like when there's the curvature, like if it's the C, like this being where the spine goes out, and then this is where, like it's instead of being like this, it goes like this. So you have that C. You want to treat a lot more of in here than out here. When it's been chronic, the pain's going to be more on the outside of the C instead of the inside, but the problem is more here than out here. Like when something has been like an acute phase, the contracted side is where you have pain, and when it's chronic, it switches to the elongated side. But the issue is like if you keep treating the area with the pain on the elongated side, it actually will exaggerate the imbalance rather than try to balance it out. And so, just make sure that, like, I'm sure the physical therapist is addressing this, and your massage therapist sounds like they're on top of it. But
No, actually, the chiropractor is doing a really good job too.
okay,
She's using a technique to help address what you're talking about.
okay, good.
So which is really good. Yeah, so it sounds like we're on the right path.
Yeah.
I just
Keep doing things that are antispasmodic and marjoram and I mean, we could throw a bunch of things at it, but let's maybe still just stick with what we have him doing for a little bit and stick with how you're treating it. Keep the marjoram on the spine, and we'll probably bump something up to that. But I kind of don't want to do too much because I really want to focus on the endocrine system and just the sluggishness of the whole body.
okay. All right.
But like
Sounds
if
great.
something starts to come up and get weird, like before, a week or two goes by, I'd say give it like at least a couple of weeks, so we can kind of see where he's at. But give it at least a couple of weeks, and then let's reevaluate. But if something happens before then, just email us or something, and we'll jump on it.